Great. So, thank you so much for joining us for NAMI Maryland's 40th annual conference. My name is Alexis Brown with NAMI Maryland. I will be your moderator for this session today. This workshop session is From Helpless to Hopeless, presented by Beth Albanese from House Calls Total Wellness. You can read more about our amazing presenter, including her full bio in the digital conference program on our official conference website. In this workshop, when deciding whether to advocate for yourself or seek an expert to advocate for you, it is most important to determine what needs to be addressed immediately since it is more serious and whether the parties involved agree on a course of action. The next consideration is whether you feel skilled to advocate for yourself and what the skill set is. Additionally, when family members are involved and don't agree, an outside expert is usually better in an advocacy role. If this is not the workshop you meant to attend, please click the back button on your browser or click on the Sessions button on the left-hand side of your screen to return to the full list of workshops we have available. We will be addressing questions at the end of the presentation. If you have any questions as the presentation continues, please post them in the Q&A on the right-hand side of your screen. We will be reviewing questions as they come in, and if something in particular is unclear or needs to be expanded, we will ask our presenter after the presentation has concluded. We are pleased to offer closed captioning for this year's conference. Captioning is only available for attendees using a desktop. To enable captioning, please click on the CC icon below the display of our presenter at the bottom of your screen. Once you click the icon, the video display will become smaller and you will see the caption being generated underneath. If you have any comments, concerns, or technical issues, please post them to our chat and our technical assistant will address them accordingly. I'd now like to welcome our presenter for today, Beth Albanese. Thank you so much for joining us.
It is my pleasure. And welcome, whoever's in the chat room. Feel free to just keep on commenting, and I'll be happy to answer any questions at the end. The business that I have is House Calls Total Wellness. And the reason why I started this business is after being in the mental health field for quite a while and noticing a lot of the gaps in the system, there was really nothing going on in the home setting where everything begins. A lot of people who are depressed or have acute or chronic life transition issues, they don't want to go to the office. They need to be able to have wraparound services in the home. And so I started this in 2004. And I have to say that my first presentation at NAMI was when I was talking about isolated adults. And after I was talking about isolated adults, I used to serve just seniors in 2004. And then we got so many referrals about people who were isolated at home with no integration options at all. So, what I'd like to do is turn it over to Jeff so he can show you a little video, comprehensive video about what house calls is, and then I'll go into detail afterward. I did it. I'm so excited. I'm doing my own slides, just so you know. Anyway, this is the beginning of the session from helpless to hopeful. And I would like you to know that I decided to call it helpless to hopeful because when you're looking for an advocate or you need to be your own advocate, a lot of times you can feel completely hopeless unless you have the support you need or you feel the confidence that you need to be your own advocate. What is House Calls Total Wellness? What do we do to help people? We're a team of diverse specialists. We're all under one umbrella. So that means we don't have to worry so much about confidentiality. Everybody knows what everybody else is doing, and we're one team. We go to the home if necessary, and we provide a wraparound approach. It could be with the whole family, it could be with one person. We don't like to label one person, so a lot of times we try to deal with the dynamic that's going on in the home and make everybody feel that they play a part. The most important point I want to get across today is that we come to you. We go where most comfortable. It could be coffee, it could be the library, or it could be right in the bedroom, sitting by your bed, trying to get you up and feeling comfortable. We assist families, young adults, senior citizens. We go to senior citizens facilities. We go to group homes. And a lot of times people are experiencing just situational issues, and then other times there's chronic life transition issues constantly occurring that need attention, some more than others, but the point is that it's a regular ongoing visit that we have with the family or the individual. Our services always include advocacy, which I'm going to talk about today, but social and recreation integration. Isolation is one of the biggest issues that we try to address and resolve. We have all kinds of different life coaching, from vocational coaching to daily living coaching to social coaching and to family coaching, getting the family involved to understand what part they play. Counseling is done either in the house, we come to you, or online. And of course, there's medical and mental health case management going on. Goals of the session today is that I want you hopefully to walk away understanding the difference between self advocacy and provider advocacy, what tools you need to be your own advocate. You need to identify when you know you need a provider to advocate. How do you know when you've done everything you can and you just need someone else to be a support system too? And then what kind of advocate do you need? It's not just anybody. You want someone with the expertise. Considerations in preparation, that is so important. You need to know the mission of the agency that you're advocating to, or the role of the professional that is going to be addressing the issue that you're speaking about. If you don't know what their role is and how much power they have, you may be talking to the wrong professional who you're going to get nowhere and you're going to get frustrated. Think about what the main issue is and the impact it is having on you, your family, or your client negatively. Try to visualize what your outcome is. If you visualize that you're going to be in control and that you know what your desired outcome is, what your expectations are, you'll present well and you'll look very poised and calm. Also, again, like I said about the professional, what professional are you going to advocate to? And who's this professional? What role do they have and how much input do they have on the problem? Do your homework so everything that you're talking about, you can give an example, which means you're evidence based. Of course, you're going to be emotional, or if you have an advocate, you're going to be talking to your advocate in a very emotional manner. But the idea is for us to try to move that away, compartmentalize the emotion, and deal with what are the facts. Where is the system or the individual that you're working with failing you? And what are the examples? And you really want to try to establish rapport with the person to prevent being defensive. So we talk about advocate, but what is an advocate? First of all, we know you can be your own advocate. We know the family can be an advocate, but lawyers can be an advocate. But then what kind of a lawyer? There are specialized lawyers who deal with Social Security disability. There are lawyers specifically for disability funding. If you're dealing with DDA and they haven't given you enough support, there are lawyers that can go after what the issue is and try to get more. Sometimes a loved one goes to court and gets sent to jail when they should have been sent to the hospital. There are child appointed lawyers, child advocates, so that issues are arising, the child is in trouble, and the lawyer is there to defend strictly the child and look at the child's point of view and what their best interests are. Guidance counselors can be advocates, but outside professionals attending education plans in a school meeting are equally important depending on the situation. The child is not going to school, could be one. The reason could be bullying, it could be social anxiety. Someone has a disability and the accommodations aren't right, no one's listening. Having someone outside talk to the team is very important. Ombudsmen, they are people that are in the county that you live in that advocate for the needs of the seniors in long term care facilities and in assisted living settings. They do not cost you a dime. You just have to know where to get them, and they will make sure that your loved one, your client, whoever it is being taken care of and represented. And we always should know whether we are working with a loved one ourselves or in the field. Child Protective Services is there for a reason. Adult Protective Services is there for a reason. They investigate issues. They become an advocate for the people there. And you do not have to tell them when you call who you are. You can remain anonymous, but they are wonderful advocates if you're concerned. So, where do we recommend advocacy? In the home setting, there could be even a family member who could be an advocate for another family member. Who does that family respect? Who can have influence on whatever the issue is? In assisted living, any outside professional, trained professional who understands what the assisted living system is about, what the staff ratio is, what should be happening there, can be a wonderful outside monitor. Day programs, any kind of subsidized program where you're assigned a case manager, it's wonderful. But sometimes case managers have a very, very heavy caseload in these programs, and you might want to hire someone from outside to monitor the system that is helping your loved one or your client. A doctor's office. Many times someone will go to an appointment and they won't even reveal the side effects they're experiencing. They may not even be aware of how severe the side effects are, or they're not taking their medicine. It could be a medical appointment where there's just not enough clarity when they come home to explain what's going on. It's always important to go with someone like that. Bring a tape recorder. It can be a family member advocating for the needs, or it certainly could be a loved one. And you can always sign paperwork so that they can speak to you on the phone as long as your loved one or your client gives permission. The psychiatrist or therapist is a very important place for you to have someone act as your voice if you're intimidated or if you feel you're just not expressing what's going on correctly, or you just feel that you've tried and tried and tried to make a point, whether it's you want to change your medicine, or you don't feel that the psychiatrist is hearing you, or you've missed a lot of appointments because you're so sleepy you can't come in and they want to fire you now. A lot of times, issues with drug and alcohol abuse have a real problem because psychiatrists sometimes won't see you if you're off your medicine and you're self medicating. That can be a real issue. And sometimes an advocate can say to the doctors, look, we need to talk about why you're firing a client who's off their medicine and using other means to self medicate. We need to talk about how we can help this person. The hospital setting, the family is always entitled to meet with the team, with the staff that's working with your family member or client. Any place that has a discharge meeting, you can be involved. You can make sure that upon discharge, the resources are there. You can advocate to make sure that the resources that are going to be mentioned are enough and that the referrals to doctors and the medications, prescriptions are all in place before someone's getting out of the hospital, including home care. Family meetings. A lot of times we go to family meetings, decisions need to be made whether a loved one's going to be transitioned, whether a loved one should stay at home, whether this person is someone that really needs to be evaluated for medication management, or whether the family's just not listening and the anger is coming from just not being heard. We give people in the family a role. Every family member can have a different role and contribute to a meeting. And we try to work what's best for the unit and the family dynamic and not blame one person for being the scapegoat. We want to also make sure we monitor home care. Home care agencies come into the home, and a lot of times they're left, families there by themselves, other relatives are out of town. There's no one there monitoring the home care system. Things can get really bad if they're not someone monitoring situations where the seniors can't speak for themselves or someone with a disability has no voice. Right now, I want you to take a moment. Think of an issue that you're experiencing with a loved one, yourself, or a client. Try to write down what it is that this issue is. See if there's a way through this presentation we can explore options. You can write them in the chat room, and we can come to some suggestions by the end. While we're talking, think about the barriers that are occurring and think about if these barriers weren't happening, how could you prevent the issues that are avoiding results? What's preventing the results? What's preventing successful outcome? How is this impacting you, your loved one, or your client negatively? Is it a professional that is the barrier, the frustration? Is it a family member? Or is it the setting itself where this is occurring? And let's see as we explore whether there could be a resolution. While you're thinking about an issue, I want you to know that our team diffuses conflict and works toward resolution using active listening techniques. Active listening is an essential skill for any advocate. Every person that works on our team, whether they are a recreation therapist, a mental health case manager, a life coach, a recovery specialist, holistic counselor, nurse practitioner, other kind of case managers medically. Myself, I'm a rehab counselor and I'm also a recreation therapist. We're all trained to be advocates. And it is very, very important for you to know what active listening is, which we can talk about in a minute. When a provider advocate is necessary, it means that you are feeling pretty anxious about this example. You've tried to tackle the issue alone and you're not getting anywhere. You know ahead of time you're going to get too involved emotionally, or you already are. It could be that you're dealing with a colleague, a family member, or a friend, and that's kind of tricky. So you may want to get someone outside to help you. You may not be aware of the mission of an agency, their protocol, the process, how to go through the system and get to the right people. You don't even know how to start to make a complaint to begin with. Or it's a matter of health and safety and it's urgent. That's when you might want to think of getting someone from outside. When you need a provider advocate, again, it could be that you're not being taken seriously. The staff, no matter what you say, is not understanding your point of view. Anything you've tried, all the communications that you've tried have led nowhere. Getting different advice from different people is sending so many mixed messages that you're getting so much inconsistent feedback from different parties, your head swimming. They're making you the problem rather than helping you resolve the problem. That happens a lot. And again, I say it over and over. If health and safety is a major concern, let's move on and get help. You can be your own advocate, though. Self advocacy is great when you're attempting to get results and you feel good about it so far. You're on a roll. Keep going. You have the confidence. You know how to get these resources. You're ready to jump in and you're motivated. You already know what outcome you're expecting. You've been there, done that. You've seen people get results. The system's working for you. Go for it. And you also know how to use active listening to establish rapport. I guarantee you, if you have these tools, you should be fine. Although, a lot of times in certain settings, even if you have all of these skills, it doesn't hurt to have extra people on your team in the school system. If you're attending an IEP meeting, an individual plan where you need accommodations for somebody, it's very good to ask for an intervention and have the principal, the guidance counselor, the family member, an advocate, all trying to get things done on behalf of the student in need. Legal, the lawyers, if you've gone through Social Security and you've gotten turned down, it doesn't hurt to have an appeal. Most lawyers won't charge you unless they get results. They should be working with you on contingency. If you found out that you or your loved one or client is going to jail instead of the hospital because of a situation based on mental illness and because they might have been off their medicine or for whatever reason, there could be a legal system on your side to avoid that jail sentence and that time. Healthcare providers are so essential as advocates in systems where there's assisted living, long term care, group homes. The potential for neglect is great, and having an outside monitor and advocate is huge to prevent a lot of terrible things that could happen. Doctors, when a professional accompanies a client to the doctor, a lot of times, I'm not saying the doctors don't take you seriously anyway, but two voices are better than one sometimes to make sure that you're clarifying what the doctor's saying. You understand that the doctor is doing their best. And if you feel this doctor doesn't have the skill that you need for this specific issue, it's okay to get a second opinion. And that other advocate is trying to encourage you to do so because they've been in that office and they see you might really need a second opinion. Child protective services and adult protective services need to hear from you and they work with you even if it's behind the scenes and the family does not know it's you. If you're a provider or family and you really need to report something, stay with it, keep calling them. They have every obligation to inform you what's going on if you're allowed to be on their team, and there's ways to be on their team. Again, the ombudsman, they are wonderful resources to be a voice of a resident in long term care and assisted living. There's no reason a family or healthcare provider should be tackling issues alone when the ombudsman is hired by the county to be your support system. And families who are not attending discharge meetings when their family member is getting out needs to know if the family is functional, or even if the family is not that functional, they can still have an advocate go with them to a discharge planning meeting to make sure that the integration back into the community is going to be successful. And we have a specific person with House Calls Total Wellness that goes with families to discharge meetings to ensure that the resource meeting is successful and that person is going to have medication prescribed, the right psychiatrist on board, anything that they need to get out of the hospital so that the system does not fail them once they get back in. You can do this. You really can do this on your own if you just remember learning active listening techniques, which means having eye contact, clarifying what the person is saying, reframing what the person is saying, and then summarizing to make sure that you heard them is imminent in being successful. I taught active listening for 19 years at Montgomery College in their mental health program, part time while being in the mental health field for so long, doing other things. But that was the one thing that I learned while I was in school and then taught to be the most effective tool that I have. Do your homework and prepare for a meeting or a phone conversation. Stay calm. Don't personalize this. Don't let this define who you are. Have a plan B. Don't get intimidated or defensive, or they're going to know it and you're going to lose your power. You don't need to turn your power over to somebody else. Stay in control. Ask what they're going to do to make it right. You have a right to know what they're going to do differently. And then, if you still need more from them or they're just not getting it, you can walk out with your head held high, agree to disagree, remain respectful, and then you know you're moving forward. You're either going over their head or you have other people you're going to get involved with to help you, but there's another plan because you have a plan B. Getting results is so important. And again, you'll get results if you use your active listening, which is your essential tool. You speak without judging people, or you're not getting really escalated in your tone. You're not getting angry. You're staying assertive, but not aggressive. Give a compliment at the outset to establish rapport. Talk as if you understand their position too. See it from their point of view. You don't have to agree, but just try to understand where they're coming from. It could be they have a caseload of 60 people, and that's why they're not getting anywhere. All right, so how are we going to do to make sure that those 60 people, one of them being your relative or your client, is going to be heard? Inquire what can you expect next, by who, if it's not them, and when. Validate them at the end for listening to you and making sure you document everything that happened. Summarize what action steps you heard them guarantee to you. Confirm what is the preferred method of communication that you are going to have with them moving forward. Is it through email, phone, face to face, virtual? But moving forward is very important in what communication vehicle, device, or whatever they're going to use, because that's where the breakdown occurs all the time. They say they emailed you, you say you called. I mean, it just goes crazy. Elaborate on what should have been accomplished by now. If you have to call back, you'll have your notes. You'll say this should have been accomplished. What are we going to do about this? How has this lack of attention had an impact? You'll be able to say, so far, this has not been done. The impact on this has been the following, and confirm again the date you're going to hear back about the issue. Examples with these cases. I have to say now, and I didn't mention it ahead of time, I apologize. If you saw Rona Reese on the program and you saw Evan Daff on the program, they are part of my team and they're wonderful, wonderful specialists who are both sick. And I apologize on their behalf, but they're really sick. So I'm not going to let you lose out on the examples that they were going to give. I'm just going to share them for you. Examples with cases that we are working on as we speak, where we are advocating for these individuals and why are so far specialized to the situation at hand. For example, Evan Taff is a coach. He's young. I'll say he's in his 40s. To me, that's young. But anyway, his clients are anywhere from 25 to 45. They need someone, the clients need someone, Evan's age, Evan's experience, to normalize the situation when they are in need. There are times where Evan will go with the male client to the doctor and will advocate because this client is off his medicine, very, very tired, can't really even think straight, and he will be able to get back on his medicine if he gets a little bit of motivation from someone by his side, walking with him, walking behind him, coaching him, but being an advocate as well, and trying to make sure that the doctor is hearing what this person is saying. Evan can be a coach. He's gotten another gentleman a job, but this gentleman doesn't have enough hours. And Evan becomes a coach and an advocate to talk to the supervisor on the client's behalf to see how he can get more hours or if there's any skill set that Evan needs to help him with as a supportive coach to get him those hours with training that Evan's going to provide to get him on the right track. There are all kinds of things going on that Evan can do that's more normalizing because he's a coach with these young adults, more normalizing in age and also more normalizing for them in establishing rapport and trust. Another example where an advocate is needed is seniors, seniors in hospitals. We have had several seniors in the hospital. Families are not in town and they are from other countries and they have been left to their own devices to order their food, to read a dietary plan, to call the dietitian. It could be either the phone or the menu, and what happens when we're called? And we're called either by an ombudsman or somebody that has heard that this person can't read and wasn't fed, or something else has happened culturally that has prevented this person to get their needs met in the hospital. It's outrageous. But sometimes, again, in a hospital setting, nursing home, there's a lot of wonderful staff, but they're very, very busy. Another situation that we've had recently is a young man was fired. He had a job coach in a program that I won't mention in one of our programs that we work with. He had a job coach, but the man was fired because the supervisor at work thought he was taking drugs. We were called in because his job coach was out of town. We were called in to intervene because it turned out that this young man was having side effects from his medicine. He was not on drugs and he lost his job. And the person that was his supervisor didn't understand any of this. And he didn't have his typical job coach in the program to advocate for him because that job coach was away. So we were called in, got permission, and met with the supervisor and got his job back. And believe me, that does not happen that often, but it did happen this time, and it was a successful story. Rona, as I said, I would mention her situation that she's had to be an advocate for. In the hospital, we've had seniors who have been in their diapers for hours, or they've had a fall and it was not reported. And we wouldn't have known if we didn't have someone from the outside give us a call. We were hired to investigate and try to become that senior's voice. A facility sometimes does not inform the family member about a fall. That is serious business. And Rona is called in a lot of times to be able to help make sure that she calls in the meeting with the discharge team because she's going to sometimes get that particular senior out of that facility and have them moved right away. I've had situations specifically where we've placed home care aides at the home setting with a lovely, wonderful woman. And she just wanted to help this home care aide out. So no one in her family knew that this wonderful senior was paying for tuition for one of the aides' little boys' daycare. I mean, I could tell you more stories about another senior who gave money to an aide for carpeting, another senior sold some of her dishes, and nobody knew about it. Now, it's one thing if there's an arrangement between the agency, the aide, and the family, that's a wonderful thing to do together. But a lot of agencies have rules and regulations that they're not supposed to take gifts. And the agency didn't even know this was happening until the family hired us to go in and find out something's not right. The senior citizens didn't have her allowance. She didn't have any of her money. A lot of times we're called in because there's no word about subsidies. Someone hasn't heard about their housing and they're on a waiting list. They're on a waiting list too long, or they haven't gotten their Social Security disability and they don't know the name of a lawyer, or there's family system issues. The client doesn't want to move out of their house, or the client that we're working with has been in their bedroom for 2 years hibernating, and the family, the parents, don't know what to do. Most recently, Rona, my life coach, went to the sheriff with a parent because the parent could not go to the sheriff themselves. And Rona became the voice with the parent to get the sheriff to come get this young man help. He needed help, he needed to go. And now he's doing great. Other examples, hoarding issues. That's such a huge one where we know an intervention is needed and nobody knows how to handle the person who's a hoarder. And sometimes it's just getting someone that the person who is hoarding respects, and that person becomes an advocate and tries to be the voice of the hoarder so that the person gets rid of their things very slowly in a timely fashion, but is willing to work on getting the house in order. Drugs and alcohol, again, another reason why we have clients in their bedroom and off the meds. Some are taking drugs and alcohol instead, and the parents don't know how to deal with this. They have no control, and their house is taken over by the family, by the client. And so we come in and we try to see how we can be an advocate, be the parent's voice to help them create leverage, but also be the client in the bedroom's voice to see how we can make sure that they're not going to be abused if we're going to have to get something to help them as well. We have teenagers at home and they won't go to school. There's bullying. There's unknown reasons why they won't go to school. We have to help them, and we create accommodations and we create meetings and we deal with those situations. And a lot of times it's Evan, our younger coach, who might go in and speak to the young male senior, or we have student interns who might speak to the females at home on the same page. They can really get on the same page with them. Seniors at home and not taking their medications, and they don't think they need home care, and they don't think they need to move, but they do need care of some kind. We're hired to go in and be an advocate, and sometimes we're an advocate for the seniors to say this person has a right to stay home on their terms, but we have to work on how to keep them safe and talk the family into understanding that staying home is their identity. It's very difficult for them to just pick up and transition. So, how are we going to advocate for the senior who wants to stay home, not taking medicine, and the family worrying to death that there's going to be an accident? Young adults, their first hospitalization with the mental health issue. And then again, this discharge plan is lacking. They get home, there's no plan. The young adult is incapable of going back to school, incapable of going back to their part time job, incapable of visiting their friends. They're a new person, they're not the same person. Where do you start with that? A lot of times we're called in to create the whole new life for that person because things have changed. Again, I told you about the individual and the doctor and the side effects, just repeating it because it's such an ongoing issue. Job performance is poor. We had a woman who was getting poor performance ratings. She was a music teacher and she was going to be fired, but it turned out she had early onset dementia. We got her a psychiatrist, we got her a whole disability lawyer, and she got a pension. And she moved to Connecticut to be with her family on disability. But what a disaster that would have been to have her go out, contributing such a wonderful opportunity for students in music and then to leave on poor terms with the school because they thought that she was doing either drugs or not taking her job seriously, whatever it was, she was getting poor performance ratings. Not to mention the fact that you have other resources at your side, the Alliance of Professional Health Advocates, the NAMI. NAMI is everywhere for anybody for any reason. We now serve children all the way up through senior citizens for every single situation, whether it's acute or chronic. And anytime I have an issue that I need help with, I call NAMI. The ombudsman is also anytime I have an issue and I need to find out how we can get immediate results, I call and make sure there's an ombudsman in that county. Lawyers, make sure that the lawyer is trained in the specialty area that you need. Otherwise, if they're not trained, you're wasting your money and your time. The Mental Health Association, which is Every Mind, has been there forever and is such a wonderful resource for hotline, for case managers, for friendly visitors, you name it. I used to be on the hotline when it was the Mental Health Association, and I was a case manager when it was the Mental Health Association years ago. And it was just such a wonderful experience to make a difference with people who were in that situation. And they still haven't changed, they only get better. We know about helpline numbers 988 211 911, the Crisis Center, Child Protective, Adult Protective, and Health and Human Service in your area. All of their directories are all there for you. The summary of options that I think you really need to be aware of, where you become your own advocate, you know you need to have ongoing monitoring. The hospital setting. You can always go to the risk prevention department in a hospital. People don't know about that, but they do not want a lawsuit. And if you're not getting anywhere, you just say, I need to speak to someone from risk prevention. The assisted living. Again, always go to the ombudsman. The doctor's office. Always take a case manager or family member. Laboratory, x-ray results. You can always get family permission to call on their behalf to find out what's going on. The school system. You can always get meetings, request interventions, resource advice. You can always ask for appointments for any type of resource, even the recreation department, where I worked for many, many years, and I taught there too. As an instructor, we would have people with disabilities come meet us ahead of time and ask if they could bring an aide with them because they just didn't understand the directions. And the meeting was wonderful, and they were allowed to do that because accommodations were made. And subsidies, you can always challenge the system. Why do you have to wait to find out what's going on? In summary, you have options. You, your loved one, you as a professional, you have options. Many advocates do not cost money. They're part of a system in your county. Retaining professionals can be very productive if it's the right one. Find the right provider by knowing where to research for one. Get your facts straight before you represent yourself. Contact the people who can make a decision. Stay in control and don't give the power to others. Most important, look at these words. Visualize success. Visualize success. Be optimistic. Be hopeful. Be positive. You will inspire people. You will motivate people. Make sure you have a visual like that in your head. You want to visualize successful outcomes. I would be amiss if I didn't say that my book is now out and it's on Amazon.com. And Jeff, if I can, I'd like to show a video about the book. And then if we have time, we can go to the chat room.
Absolutely, I'll pull it up now.
Hello, my name is Beth Albanese, and I'm the author of the book From Helpless to Hopeful. This is the book. It's sold on Amazon, and you can get it on my website at housecallstotalwellness.com. The book was written for you, people who are experiencing life transitions, whether it's a one time only situation or ongoing. There is something in the book that will resonate with you to how to navigate the maze of mental health, to try to think out of the box when you're experiencing challenges with a loved one. But no matter what, you'll find something in there that identifies you with the circumstances of a family or an individual that is pouring their heart out to try to help other people learn from their experiences. If you have any questions, you can contact me. My website is housecallstotalwellness.com. Thank you. So now we can open up the chat room. I don't know what time it is. I was on a roll, so it just depends on whether we have time or not.
We absolutely do have time. Thank you so much, Beth. I just wanted to say that was an amazing presentation and eye-opening for me as well, especially when you wanted the participants to kind of participate in maybe what's going on in our personal lives
Mm-hmm.
and maybe how to manage and navigate through that. Just kind of asking those questions that you sometimes don't want to really address, but
I know.
you have to talk about it and deal with it. And that's the only way you're going to really be able to kind of come to some resolution about it. So thank you for that. I appreciate that.
Oh, my pleasure.
Yeah, it looks like Shannon had a comment. She says, my challenge is to find additional opportunities that will pay me to share my recovery story in writing or through speaking in person or virtually. So she wanted to share her comment about what she's challenged. So I don't know if you
Well,
want to share.
I know Shannon very well. Hi, Shannon. I'm so proud of you. She's done such wonderful work in the well, actually, all over the United States at this point. But Shannon, I think what we should do is have a talk outside because I have lots of ideas and it probably would take too long because it's personal, specific to you. So let me just make sure that I make a mental note to myself that we'll have to talk, you and I will steer you in the right direction, I promise.
Great. Well, she's giving you a thumbs up. I don't know. You see her comment. She says,
I
thank you
do.
for that. Good.
Sure.
I had a question. I was
Yes.
just curious as far as getting connected with your organization, how would a person reach out if they needed assistance from you all? Your
Oh,
contact
what a good
information.
question. I should have even said something about that. I'm not promoting myself enough, I guess. Um, what we do is twofold. We either are hearing from people through another family member, a friend, a doctor, or whatever, and they call. And if they call, then either myself or Deborah Norberg, my outreach specialist, will call them back And we will let them know that on our website, after we talk about the issue, on our website, there's an intake form,
Okay.
and they will save themselves a lot of time and money if they fill out the intake form. We read it, and it's a couple pages, but we read it so we can establish when we make an appointment with that person. We already have a plan pretty much.
Mhm.
And so if they feel that they don't want to do the intake online, then we will make an appointment and we can interview them virtually, or we go to the home. We'll wear a mask if they want us to, but we have no problem going to the home if you're within the state of Maryland, DC, Howard County.
Okay.
And what happens after that, after we um, visit them once or have a consult, is we decide what person on our team or how many people on our team we suggest for that particular situation. We sometimes have three people with one family, one for the parents, one for the young man or woman, and sometimes once it's somebody else that is doing resources. Like right now, Tori Ingram is responsible for trying to get someone into housing. So she would be the one applying for housing with Core Service Agency. While Alexis, our other holistic counselor, is talking to the parents to have other ways to talk to your daughter or son. And then we have Evan, the coach, who's sitting there trying to coach the son. So the
Mm.
best part about it is we can put all these people together, or we can do one at a time. And we try, people are going to ask, how much do you charge? We don't take insurance. I hate it. I'm sorry. We go to
Mm.
the home, but it's such a liability when we go to the home like this.
Mhm.
But we do try to work it out in some way where some families will cap. They say,
Mhm.
I can only pay this much a month, and that's all I can afford. And then we try to figure out how we're going to do that. We do have a social club for
Mhm.
people who are getting out of the hospital or individuals that just don't feel socially connected. Debbie Marcus, our rec therapist, she is unbelievable in designing social networks for people, either individually or as a group, so that they have integration and options so that they're not isolated.
Oh, that's great. And that was another one of my questions is how large was your team of people that you have that support you?
We have about 10.
Mhm.
So we have Alexis is our holistic counselor. Marcy is our therapist. We have Shireen is our life coach. Evan's a life coach. Rona's a retired occupational therapist, so she does everything, but she does coaching. I'm a rehab counselor and a recreation therapist. We have a billing, someone who deals just with insurance. We have Tori who deals with the liaison between the hospital and getting people, their housing and their needs met. I hope I'm not forgetting somebody. We have a bookkeeper, we have an administrator. Oh, and Deborah, our intake person.
Oh, yeah.
She's like my right arm. So we have a big team, but we do a lot of virtual all over the United States. So we are there for people not just in Maryland DC metro area. But thanks
Right.
for asking.
Oh, no, sure. And that was going to be another one of my questions too about other working with other agencies. So you do work with core service agencies throughout the state and different areas and
Oh,
other agencies.
I don't know what I would do if I
Mm.
didn't collaborate. We have clients in Cornerstone, Montgomery, and we
Mm.
have them because we refer them to Cornerstone. And then
Mhm.
sometimes the families want us to continue. So that's an example of when we might monitor and make sure, because there's a lot of case managers there. They're wonderful, but they have a big caseload. And
Yeah.
sometimes the families have expectations and it's not moving fast enough. So they are willing to pay us, not every week, but just to be an advocate to make sure our clients are okay. We go to assisted living facilities and we have seniors with mental illness. A lot of our
Mhm.
individuals now are older and they still have mental illness and they still need to go to long term care now. Well, some families want to pay us to go there, and we're there and we make sure they're okay and we advocate for them. And it's a little less taxing on staff who do not have the time to work with one on one when a
Right.
senior has dementia and bipolar disorder.
Yeah.
So we collaborate. Ken Weston is he's like our guru for Core Service Agency. He's been there forever, and I've been in the field forever. So basically, if you can have a village working,
Mhm.
wraparound services is the way to go. And
Absolutely.
if I can save people money, Anybody who wants to call me, if they can't afford us, I will send you somewhere. I
Oh,
guarantee you, I will send you somewhere so you won't be left hanging.
oh, that's awesome. Thank you, Beth.
Sure.
In the last few minutes we have left, there is a question that came through. Gordon would like to know, have you worked with young people with schizophrenia?
Absolutely. I have worked with young people with schizophrenia. As a matter of fact, I have one young man. It's the first time ever in all these years that normally my policy is if someone's off their medicine, whether it's schizophrenia, bipolar, whatever it is, ADHD, we don't like to work that necessarily with people who are on drugs and alcohol compensating or on taking their medicine. Why? Because sometimes it's a waste of money because our goals are forgotten when we put goals in place, or the person just forgets what we said the next day because they're just not concentrating. I have one man with schizophrenia who's 31 years old, and my coach Evan is working with this young man, and it's amazing. Why? Because Evan established rapport with this young man with schizophrenia, and through his karmic connection, they've gone horseback riding, they are going to some kind of car show. And
Oh,
I don't think I've ever had a client that has benefited off their medicine routine by the social recreation and individual connection. So,
yeah,
yes, we work with people with any kind of disability, but there are protocols. And this
yeah.
one just broke the bank as far as I'm concerned. So, I'm not going to say we never do anything anymore.
Right. Thank you. That's awesome. That's
Yeah.
so good to hear. I don't see any more questions. Let me see if there's anything in the chat right now. Shannon did mention that she is willing to share her recovery story, and her information is in the chat if anyone is interested in her amazing, amazing story. So, thank you again, Beth, for that. Um, that's all we have time for right now. So, we would just want to thank you all who are joining today.